questions could you please answer these? I'm sitting there and I'm saying to myself,
Rush Limbaugh, the racist.
another syllable to these people. They make it up anyway. They do not report accurately what I do say. They make it. Why should I give these people any of my plans?
Though they weren't effective beforehand. I only get 9 migraine pills a month. When I'm going through a migraine cycle, I get 3 or 4 migraines a week. It takes 2 pills a migraine. I run out of pills and 3 or 4 migraines last me a month. They're around $200 for the 9-pack without getting covered by my insurance. I'm owing my family money every day because I can't pay for my pills that are just simple necessities. I'm not in horrible debt, but I'm not making any money with the money I'm spending every day on pills that the insurance company won't pay for just so I can get by on a day-to-day basis.
Anybody who borrowed a
Even if you didn't say it, it's sort of like
I'm David Lincoln. I'm here from Louisville, from Phoenix, Arizona, because my mother has breast cancer, and she is on another health insurance corporation's insurance, United Healthcare. As a patient of United Healthcare, she receives treatment, but she also has to go to work, bald, sick, nauseated, and without the ability to stay home and recuperate, and has the stress of almost losing her job every day because her performance is inhibited by her cancer. We need change. We need a public option, or we need single payer. And single payer is the answer to our corporatist and American broken healthcare system. It's the only way we can get this country around the bend and get the economy back where it needs to be is to eliminate 30% profits. $104,000 an hour for Helmsley at United Healthcare is a crime.
Yeah!
It's a crime. Yeah! It shouldn't happen, but it happens in America. The president makes less money a year than the people making decisions about health care to deny you, the American people, your right to health care. Health care is a right.
Yeah!
It's not a privilege. Health care is a right. Everyone here deserves treatment like anyone else in the world. The industrialized countries of this planet have single-payer health care. They get health care. If they're sick, they can stay home. They can recuperate and come back and be a productive member of society. Instead, my mother has to go to work bald, sick, tired, nauseated, and fearing for her job because she has to keep insurance. It should be a crime to profit on health care. That's all I've got. Health care for everyone. Single payer America. It will solve our economic problems. Medicare for all.
Medicare for all.
Are there any other stories that anybody else would like to relate?
Yes, our friends Paige and Steve from Louisville, Kentucky, about an Electrolux vacuum cleaner when he was selling door-to-door on commission. We loaned him money when he had the opportunity to buy an Electrolux dealership in New Orleans. Of course, their home and business was destroyed with Katrina. Paige is a 7-year recovering alcoholic. However, she discovered she had cancer, and the doctors got her on Medicaid or disability very quickly, but she has to wait 2 years to be covered for her treatment by Medicare. You think her cancer's going to wait 2 years?
No. They tell you who I am.
Trigger. Why don't we come over here and stand right over here so they'll be able to hear inside.
Oh, okay.
Sort of stand in the middle. Yeah, there you go. Thank you.
Good afternoon, everyone. Can you hear me?
Get close.
Thank you.
Can you hear me now?
It's so intimidating.
Can you hear me now? Good afternoon, everyone. My name is Jim Marquardt. I'm a retired CPA, and I'm a member of the Republican Party. So, but not the religious right, and people have been causing all the problems
at the town meetings around the country. Fortunately, I don't have a story to tell you where I've been sick and have been denied coverage. I spend less than $2,000 a year for all of my medical costs and insurance and everything, so I'm fortunate. But I'm here today because I think our system is wrong, and I think the system could be corrected with single-payer insurance.
Get a copy of your video. You're doing video. Get a copy to send to move on.
This is a simple dream that I have.
Potentially, I'm actually with the
It's very simple.
Oh, okay.
No one has done a cost
So
study,
it's going
but
to be on the
from
internet.
what I've
To
seen of the
will.
various
Add
cost
your
studies that
list.
come
The fat
close
lip?
to doing it,
On Fat
we
Lip?
could cover everybody in this country, remove the burden from the small businessman, and do it at a lesser cost than we're spending in total today. So that no one wants to take and face the facts. As soon as we face the facts, we'll find that we can have everybody insured at a cost less than we're spending today under the single-payer approach. And each of us can pay a nominal amount of copay out of our own pocket, and we can follow the true principle of insurance, which is if everybody's covered, then the few people that have to use it, the unfortunate ones, have the money there for them. It doesn't go into overhead, it doesn't go into advertising costs, it doesn't go into corporate salaries, it doesn't go into profits, it doesn't go into income taxes. 40% of the cost of your insurance goes to the government. But the government today pays over 61% of all of our costs. So they say they don't want the government to get involved. I'm on Medicare. VA insurance does a very good job. I think Medicare can be done for all. It's a matter of getting our corporate politicians educated. And as soon as we get them educated that they'll no longer be going back to Washington, I think we'll have single payer. It's coming. It's just a matter of time. God bless all of you.
Everybody in. Medicare for all. Everybody in. Medicare